name is Jackie. Today, I'm very glad to be here and share with you an important topic, the choice of life and death. So, a dying old man lies in a hospital bed. There are several tubes on his body, in his mouth, and in his urinary tract. The tubes are linked to several machines, only to maintain his life. The old man feels so sad and lonely and painful. He cannot talk because there is a tube in his mouth. He cannot move his body because he is bound to the bed. He remembers a few months ago when his children and grandchildren would come to the hospital to take care of him, but now they are all gone. Now only doctors and nurses would come to the room and take care of him. And sadly, after a few days, the old man passes away in regret and loneliness. So everyone wants to die peacefully and painlessly. But with the advance of modern medicine and technology, it is harder and harder for people to die naturally. Now when the patient is near dying, he is then sent to the hospital. And the doctors and the nurses try their best to save the patient's life. They put endotracheal tube inside his mouth to maintain his breath. They do CPR for the patient to maintain his blood flow. They defibrillate his heart to prevent the heart from stopping. And some doctors even use ECMO to maintain the patient's life. But this may sound good for those who had an accident because they deserve a longer life and they have much more things to do in their remaining life. But for those whose life is about to come to an end, these actions to them may be like endless torture and hell, because mostly elders have loosened teeth and weakened bone, and when they receive CPR, often their bones cannot sustain the force of CPR, then their ribs may break, and their loosened teeth may be knocked off by putting the endotracheal tube. So they may die in pain and regret. And Dr. Cole once said that there's only two ways of dying. One with a tube and one without an endotracheal tube. So you surely can choose between the two. And so today, I'm going to talk about the concept of DNR. So what is DNR? I think most of the people have heard of DNA, but DNR has nothing to do with DNA. And DNR is also not the abbreviation for do not run. Instead, DNR means do not resuscitate. It means that after you sign the DNR sheet, you are not willing to receive any of those like CPR or endotracheal tube or defibrillation or some other life-sustaining system, so that you can die naturally and die peacefully. But many people have a misunderstanding about DNR. They think that if they sign the DNR sheet, the doctor won't save their life if they had an accident. And I can tell you that this is totally wrong. Because first, if the doctor don't save the patient, they will get sued by the patient. And second, DNR only applies when two doctors check the patients and agree the patient that their death is near and irreversible, so that they can die naturally without the interference of outer equipment and torture. So that's why DNR is also called allowed natural death, AND. So how can you ensure your right to have a good death? So first, you have to be more than 20 years old, which I think most of the people here, all of the people here, have already passed the limit. And second, you have to go online to download the DNR form or go to the hospital to receive one and sign the DNR form with 2 other people aside, and they also sign the form. And after that, you just send the DNR form to the Hospice Foundation of Taiwan, and they'll take over it, so that you can ensure your right. And a French surgeon, who was also a Nobel Prize winner, Alexis Carrel, said that the quality of life is far more important than life itself. So I think lying in the bed and not be able to do anything is nothing but torture. And to prolong the process of death is meaningless. So why not give you a chance to enjoy your life and ensure your right to have a good death? Thank you.